AI potentially, getting more and more integrated into our lives and into mental health care is the ability to help prompt and remind people, because I think so much about mental health and work in that field, it relates to patterns we have, a pattern of thought, pattern of reaction, pattern of behavior when this thing happens, and they are things that are ingrained in our brain. So a lot of work is slow and subtle over time of developing new patterns, and that takes a lot of diligence, that takes a lot of reminding, a lot of keeping it visible. And that's one thing that I think like AI can hopefully become, and some of these tools could become more helpful as like prompts and reminders for clients.
Hello, wonderful listeners. Welcome back to another exciting episode. I'm Arvind Ryan, CEO and Chairman of Copper Digital. Today, I'm thrilled to introduce you to a remarkable guest who wears many hats in the world of mental health and beyond. Our guest is a licensed psychotherapist, entrepreneur, and advocate for mental health. Currently practicing in both Colorado and California, his journey has been nothing short of remarkable. From his graduate studies at the University of Michigan to working in diverse settings such as inpatient and outpatient hospitals, community mental health clinics, and nonprofits. He's a trailblazer in the mental health space and recently ventured into the digital realm with the Para program, which I can't wait to learn more about, an online course aiding those grappling with panic attacks. An advocate, entrepreneur, and globetrotter, he brings a unique blend of experiences to our podcast. Without further ado, let's welcome Ryan DeCook. Ryan, thank you for joining us.
Hey, thanks for having me. It's good to see you.
Fantastic. Well, let's begin with what inspired you to transition from a tech startup in HR to becoming a licensed psychotherapist specializing in trauma and anxiety disorders.
Yeah, so I think there are a few things that kind of came together around that time for me. I had already been doing the work in South Africa, and a lot of that was directly working with people and helping and serving people. And then I kind of got in the business world, and I realized I was kind of informally finding myself in a lot of like counseling type positions. And
as in HR, it's easy to find yourself always just, that's awesome. Okay.
Hashing out company drama and with people, listening to people, complain and things like that. And it was also a really intense environment too. And I got to a point where a few years in where I just was feeling pretty burned out and kind of hit a wall and was like, I need to make a change. And so I knew I was going to leave. And I did that, took some time off, did some traveling. And I think that burnout and kind of my own dip in mental health caused me to pursue a lot more mental health services for myself, just doing some therapy and things like that. And as I was kind of on my own journey and learning more about the brain and mental health, I was really excited about that. And so I kind of, was thinking about my past and all these sort of natural ways I've been in these like counseling type positions, and thinking about just my natural skills and gifts was like, I think that's all kind of converging to come together and point me in this direction to go become a therapist for myself. So that was when I started making plans and looking at grad schools and things like that.
Wow. No, that is so inspiring, because I feel like everyone sort of goes through this journey where they have a little bit of a burnout, and then they look for maybe how to maximize happiness and find meaning. And a lot of people go on this search, maybe through meditation, maybe through following some influencers. But I think you went above and beyond and got an actual degree and went to school to become a therapist, which is commendable and super inspiring. I love that. So you launched the Para program to aid those with panic attacks. What prompted this, and how does the online course extend mental health support beyond traditional clinics, bringing unique benefits?
Yeah, great question. As I've gotten into the mental health and made it through grad school and started doing my, we have to do like thousands of hours before we get fully licensed, and then we get licensed and keep practicing. So all through that process, I found myself, I was actually working in a hospital system for a while, and kind of fortuitously found myself positioned in running a group for people who struggle with panic attacks, and kind of ended up running that program for that department, for that psychiatry department, and kind of got in and fixed up and developed a new curriculum. And so I've worked with, through that group and individual clients, like probably hundreds of people that have struggled with panic attacks, and just heard story after story and got a lot of insight on what that is like for people and how scary that is and intense, and how much it can really just sidetrack someone's life. And really what it does for a lot of people, it really shrinks their life, that it makes them feel like they can do less and less and avoid things more and more, and can just have such a big impact. So I really love learning about it. I love working with and learning about anxiety and panic, because every human being actually has a anxiety and panic system sort of wired into it, like a fight or flight system wired into it. So it's a very human experience, actually. And there's a lot of ways we can work with it and actually help it in significant ways if we go about it the right way. So just learning those things over the years, I just got more and more excited about it. And then, but I am limited as a therapist, that I can only see, so many people a week in individual sessions. And so I decided to look into doing a course so I could kind of take all of those skills, all those tools that I teach people over a course of, let's say a year of individual therapy or 9 months of individual therapy, and put it all together in a more compact package and kind of get it out to more people to help more people. And so just kind of getting it in the hands of more people that need it. I mean, it is wild that it's about a quarter of all people in their lifetime will have a panic attack.
I was wondering that, okay, so a quarter of the entire population would have a panic attack over their entire lifetime.
Yeah.
And that's wow, that's a lot of people.
I mean, it is super common for people to have panic attacks, and a lot of people don't know what it is, or it's so intense and terrifying, confusing. And a lot of people think it's a heart attack or a stroke because it's so intense that way. And so a lot of people actually end up in the emergency room or doctor visits. And so it's actually a very expensive medical problem too in the world. So it's something that, I really just want to offer people a place where they can learn about it, because education's so empowering, and then some tools that can help them feel more comfortable, more at ease, find more calm, find more confidence again. Because a lot of people, it damages their confidence to do life. And
No, it's definitely really amazing that you're working in this field. So Ryan, you worked in both inpatient and outpatient hospital settings, right? So how do you see the balance shifting between traditional clinical settings and online platforms in delivering mental health care specifically?
Yeah. Well, I think the outpatient space has significantly moved since COVID in the direction of online and mental health care. I saw a study recently that was, it wasn't like a countrywide, but it was a significant number of clinicians that were studying. I think it was 75% offered telehealth services now. I don't know if that was only telehealth, but at least some offering of online. So it's significant how fast it's shifted in the last 4 years in that direction. And I know that for a lot of people, that's been a great thing. They're excited. I have people I work with, because I only do telehealth.
Okay.
Right. And so I work with a lot of people that probably would have not stepped through the door of mental health services without that being the case. They can be in their car on their lunch break at work, or they can be in their living room at home. They feel a little bit more safe that there's a screen in between the therapist and them. So a lot of people love it. I know there are people that really love the in-person dynamic. And so they find it a little bit harder to find in-person services sometimes. That has become tougher in the outpatient services. I don't know if it's changed inpatient too much, because you still have to be in person, and those are the most severe cases usually. It has allowed it, more access to like when I was working at inpatient, they were using telehealth and tablets to collaborate with family members, right? So family wouldn't have to come all the way into the hospital. You could have a family meeting with the tablet right there, or things like that. But at the end of the day, you still have to have the building and the in-person component. And there are certain cases, especially if someone's severely suicidal or having, severe hallucinations or something, they need to be in person, and an outpatient telehealth probably isn't really appropriate for that level for the level of care that they need. So outpatient definitely swinging that way, but inpatient still is kind of steady with some of the core of what it needs to be.
Makes sense. No, that's a good example. If someone's got really an acute challenge, then of course it's much better, for them to see somebody in person and not access, the virtual platforms. But is it also the other way? Like, are there some cases where, like you said, maybe that screen gives that additional, protection against that vulnerability that comes with having this experience as well, I guess. But are there others? I wonder, because I was also talking to a speech therapist, and they have obviously, the telehealth component to it. And a lot of the kids really like doing that speech therapy, just on a computer screen. It's like a game for them, say this or say that. And I feel like also, of course, for people that are in remote areas, it's just, such a boon to have access to mental health, which otherwise I don't think it would be possible for them.
Yeah, absolutely. I love it. I'm a big proponent of it. And, we haven't done away, and I don't think should do away with all this, make everything 100% digital at this stage. But I think it offers so much benefit. And I don't think there's much drop off in terms of outcomes. If there was, I wouldn't be doing it. But from what I've seen, you can still get great outcomes in terms of mental health with through the telehealth platforms.
Yeah, got it. So as healthcare becomes more patient-centric, how can technology empower individuals to actively participate in managing their mental health? And do you have any examples from your practice?
Yeah, so I think that there are more tools, there are more opportunities. I'd say like right now, what I've seen is like there's a lot of tools that are kind of like ad hoc or like the add-ons, right? Like you can make I can in 2 seconds send someone a link to the video I want them to watch that week, or I can give them the download link for this app that gives them the meditations or mindfulness exercises that they need, that just makes it accessible, and then they have it in their pocket on their phone or on their tablet or computer or whatever. So I think that's great. I think one of the things I'm excited about with like AI potentially, getting more and more integrated into our lives and into mental health care is the ability to help prompt and remind people, because I think so much about mental health and work in that field, it relates to patterns we have, a pattern of thought, pattern of reaction, pattern when a behavior, when this thing happens, and there are things that are ingrained in our brain. So a lot of work is slow and subtle over time of developing new patterns. And that takes a lot of diligence, that takes a lot of reminding, a lot of keeping it visible. And that's one thing that I think like AI can hopefully become, and some of these tools could become more helpful as like prompts and reminders for clients of like, hey, here's the plan for the week, some stuff you'd wanted to work on, or here's your meditations for the week, or your worksheet, and here's the reminders. And so it can hopefully help bring higher levels of engagement. And then along with that, higher levels of new habit building that's going to positively impact their mental health.
Yeah, no, that's super interesting. I think but there needs to be some sort of a closed feedback loop, meaning like, let's say we come up with an AI-based notification for whenever we think that the user would, or the patient would benefit the most from, a reminder. But then like, what is the data that's being fed into it? I think that maybe that requires some notes from the therapist, or perhaps access to some other data on the phone, and that can be done securely. But I think there needs to be still some close feedback loop. I mean, and I feel like this is gaining popularity across the board, meaning not just for mental health, but even something like learning a new language. That would help a lot. If we could have that patient-centric AI-based notifications. I love that idea.
Would. And where it gets exciting or really helpful, I think, is like with because you're talking about like what prompts the notification or what prompts like, hey, use this coping skill. And there is more technology that's been worked on around like, like sentiment and voice recognition or certain biomarkers or things like that. So there can start to be, and this is very, this isn't widespread yet, but exciting for the future to think about of like, what if you could know that someone's heading into a manic episode, or they're right at the precipice of a manic episode, or a depressive episode, or they're, tending towards patterns of the last time they were suicidal, or they're trending towards a panic attack, right? And then with those markers or that sentiment analysis or whatever it is, could then prompt that notification and catch them hopefully before they head into the peak of some of those things. That could be really powerful.
Super. And yeah, that could be integrated with our Apple Watches and, have those vitals. I mean, I think there may be a time soon when there could be more of those biomarkers as well that could be available, except for just, the basics. That's super fantastic. Okay. So in adopting new technologies, how do you strike a balance between innovation and ethical considerations, particularly in ensuring patient privacy and data security? Because, we talk about giving access to our phones, or maybe there's an AI that's aware of your mood, like you said, based on your voice. And then there could be that setting. I mean, that opens up a lot of possibilities for, these types of data breaches. And so how do we strike that balance?
Yeah, it's a great question. I would say the first thing that comes to mind, and because this is big in our field, is consent, right? So informed consent, so that people really clearly know what they're signing up for and what they're giving to, right? So you're not only just saying like, here's what it is, here's how it could benefit you, but you're also giving like a picture of like, here's some of the risks with your data, or here is, depending who it is, if they're going to sell your data, they should tell you they're going to sell your data to someone, right? And but in a very clear way. So I think really obvious consent is important. I think also quality research is important, right? Because we can advance technologically, but we also need to validate stuff. And I think that is definitely a challenge. And even in the mental health field is like, and in a lot of fields, but technology outpaces research a lot of times in terms of like validation of outcomes and things like that. Like I remember when I was at University of Michigan, I was doing some work on like these different centers, mental health centers around the country, and they were presenting some of their research at one event I went to, and it was like a cognitive behavioral therapy website that looked like it was from like 10 to 15 years ago, and they were producing their results on the outcomes of that website. And I was thinking, man, we're researching like 10 to 15 years ago. And so like, I think research definitely needs to be a big part to make sure what we're putting out there is safe, it's effective, it's going to help people, but finding a way to like close the gap on that time window of how much research can sometimes lag behind. And maybe that is something, and I don't know, but maybe that's something AI could help with too, of like finding ways to speed up the process of of studies and scientific studies and ways to validate and research technology more quickly. But I think those are the two things that come to mind for me, is really just like the consent and then the research to like support some of these evolutions to make sure it is safe for people.
Absolutely. So consent definitely, and research too. I see your point there. And I think I'm usually not very much about regulations, but I think there could be some regulations that might also help, because I mean, even if you get consent, like you shouldn't be, getting that personally identified, information to, you shouldn't be selling that at all, like at any point. So I think there can be maybe some guidelines around that too. But I also feel like different people have different levels of privacy. I mean, I am on the side where I just, haven't really cared that much, but I'm also guilty of then, a lot of times having, some leaks as well. But what's your take on this? Like where are you on that, spectrum of being extremely cautious versus, just letting anyone being super transparent.
So for me personally, where am I at on that?
Yeah. Just wondering.
Yeah, I think I kind of am probably somewhere in the middle. I'm definitely someone that like I am interested by new technologies or like kind of exploring something or being willing to sign up, give my consent. I'm also someone that like most of the time when a website pops up and they give me the cookie settings, like I'm usually going to take the extra 10 seconds to click in the settings and turn off all the unnecessary cookies. And so I try and strike a balance. Like I'm definitely not someone that I'm anti-technology and no one's going to have any of my data ever, or because if you want to learn or experience new technologies, it's almost impossible to take that mindset. But there are still some things for me that I'm like, I still want to have some control or some things I can turn off or not consent to if I don't want to.
Totally. Yeah, no, that sounds logical to me. So, okay. Well, looking ahead, what specific technological advancements do you believe will be game changers in mental health care, and how might they revolutionize the treatment approaches?
Yeah. Well, the one we've been touching on and everyone's excited about, AI, obviously, is hot topic. And I think there can be some pieces where that could really play in. I think there's few aspects around where that can affect treatment. I think it starts out with and because it's already happening, it's not widespread or ubiquitous, but it's being used in diagnostically. I think there's great power in how effectively we can understand what's going on with someone. And that's taking self-reported information from people, that's taking results from questionnaires that could potentially be starting eventually to include some of the biomarkers we were talking about, and starting to give clinicians some really powerful tools to really be spot on with what's going on with people. I think there's some real power there. I think there's some opportunity around, along with that, some treatment planning, right? I think like there can be some powerful recommendations of treatment, pre-populated, well, not pre-populated, but once the processing gets the information from people, gets the diagnosis, gets all the inputs, then could come up with a tailored treatment plan for someone and kind of present that to the therapist of like, here's what we recommend, or here's what seems like it'd be helpful given these things that we've seen going on. I think that's big opportunity. I think that there's also some interesting components that when you start to think about more like interfaces and different hardware coming out. So like even the Vision Pro coming out soon from Apple with like the augmented reality, like kind of interesting to think about where that might go to in terms of some like more interactive things that could be worked on, like in therapy, or some educational tools or things we could, as we're explaining it, drag and drop it and be playing with that as we're using it. That's kind of interesting to think about. And then what's, really interesting slash a little bit scary, because I probably don't fully understand the depths of all where it's headed. But when you think about like the brain computer interfaces, that's how.
Oh yeah.
Neuralink, things like that. That's pretty wild to think about what that could do. I think for people with limitations, or if they have like disabilities or something, I think it could be incredibly helpful. And that's some of what I think the mission is for them, to create more access to doing more things in life. But really interesting to think about where that could go in terms of mental health, what that could bring about in terms of understanding, in terms of ways that we can take in and process information. So I think all, those things are kind of some of what bounce around for me as some things that are probably going to change how we do things at some point. I don't know at what point that might be, but
right. But you're most looking forward to those. Yeah. Me too. I think all of those, diagnostics, of course, and including the biomarkers. I think, recommending some treatment options. that sounds pretty interesting as well. I think, and maybe we talked about it also in the past, AI-based therapist avatar. I feel like that's the holy grail. Imagine, everyone could just have a therapist that, is an avatar, is an AI-based one, and you could just talk and develop that relationship. And, that is just the holy grail. So what's your prediction on when we could have something like that?
On when? That's the big question. Because I mean, we already have like some of the foundations of some of that, right? Like there's the chatbots that are mental health focused or kind of support focused. Like there's Wobot and WISA and groups like that are doing those type of things. I think right now already they're probably really helpful for like people that have like mild symptoms or pretty manageable things going on. And because, you put in some information, they do some diagnostics a little bit, and then they give you some things to be working on. They can give you some responses to what you're sharing. I think what's interesting about therapy is it is this kind of blend of art and science, or like this nuance and human side and science. And it will be interesting to see how quickly AI can get to that human level. I think that's the question with AI in all industries, but I think with the AGI, or when it gets to a human level, probably varies differently depending on the industry. And with therapy, there still is a lot of the human, the nuance side, right? So if you're working with someone and all the things that the book says should have been working, that person's still experiencing their symptoms, where do you go from there? Or someone that has a lot of complex things and it's not just clearly one thing going on with their mental health, like how do you sift through all that? And so that there is that nuance side and then the empathy side, right? Where we can attune to a client's emotions. And so that's really what AI has to get to. I think they can do some like okay empathy from what I've seen, like repeat back some statements that probably feel pretty supportive and things like that.
Mhm.
Can it get to a place where it feels like empathy, right? And maybe it can. I know there are some people that are developing relationships already with AI, right? Or kind of feeling connections or emotions to AI. So, I don't know if I can say an exact year for that. I think it's a little ways out. I think for the near-term future, AI is going to be a great assistant to therapists. And does it reach a place where it can kind of become a full-on, autonomous therapist? Yeah, I think it's possible. I don't know if I can say when that is, because I think the real question would be when we research, again, going back to the research thing, does how it feels to a person, does their brain interpret it enough as human, as empathy to create the change, to create that positive impact on their mental health? So I think that's really where we have to get to is it human enough to convince their brain it's human, to convince their brain it's real empathy, so that they can really feel it and then see the positive impacts on their mental health as a result.
No, I love that. I love the way you explained that to me. And I feel like it's also, we may not get there as such, but even if we're like 60, 70% there, that could really democratize access to therapy for especially people in developing countries. And
Sure.
we don't have that many therapists. And I am a big believer that everyone needs therapy so that they could maximize their potential. And, people like Michael Phelps and, other Olympians and so many people have gone through therapy. And in fact, even a lot of them in the virtual settings.
But it's that question, because so much research around mental health shows that mental health outcomes are tied to the quality of our relationships. And so that is the big question with AI and AGI is like, does it get to that level where it convinces a person's brain and their system enough that it is human, and it is a real relationship to the point that it then benefits their mental health?
Yeah, I don't think it can. I mean, I don't see how, but I guess it's working for some people. There may be some sort of, hypnotism involved in that. And it's possible, like for short periods, maybe you do that, but who knows? But I still think it's, we can get there in the, in like the next decade. I think to a point where a lot of people would definitely have that type of a tool. I definitely feel that that's possible.
Yeah, and I think that'd be great. Like you said, the more widespread, more people getting some tools that they have access to. And again, like I was talking about, that prompting, that reminding to like be doing the stuff that's good for them. Like if that gets more widespread, I think that's a great thing.
Absolutely. Well, good deal. So given your entrepreneurial background, what advice do you have for therapists looking to leverage technology to enhance their practices or create innovative solutions for mental health care?
So thought about this some lately, like there are some tools out there that are starting to make it really easy for therapists to do their own practice, that make it, even if you want to take insurance on and work with insurance companies, that make it super simple, super effective. I mean, there are some that are better and more ethical than others, so definitely good to do some research. But there are some tools coming out that are making it so much more simple to be an entrepreneur, to have your own practice than ever before, and especially around telehealth. So there's just so much opportunity. And I know there are still a lot of people that makes them nervous, or they like the consistency of a W-2 job and a paycheck, and that's fair. And that's, some people would prefer that. But if you're on the fence, I'd say at least explore, right? There are some great tools, great opportunities. My wife and I, she's also a therapist. We transitioned last year over into running our own practice and using some of these tools. We had been working at a group practice with someone else, and we've loved it. It's been so great to have our own practice. And I think also more and more therapists are also thinking about, a lot of therapists have a really good knowledge base or skill set that can help people. And so thinking about the stuff like I was doing with the PARA program and Panic, it's like, what is the thing that you can share with the world that goes beyond just your own therapy practice? And is that, a podcast? Is that an online course? Is that, a newsletter or blog that you're doing, or, however you want to do it, and even to monetize some of those things, but just to have more impact. And again, with those things too, that the tools are there. Like it is so easy to build an online course now. It is so easy to start your own podcast. And there, granted, it's more saturated, the market, because more and more people are doing it. But the tools are there, the opportunities there. And I think a lot of people are moving that way, and just kind of realizing that, it can be hard sometimes to find a place of work or a clinic or something where you find that, they treat clients amazing, they treat their employees amazing, they give, they pay really well and give good benefits. It can be kind of hard to find all of those things together at a place of work. And so it is exciting that there are these opportunities to go and explore. And even if you want to work with certain populations, you can still do that. Like I'm currently in the process of getting credentialed to work with some Medicaid clients. And so it's like you can still serve certain populations even if you're doing it for yourself. You don't necessarily have to do it for a clinic or working for someone else.
And do you have to have a license for every state? If you're getting any patient from, let's say, Texas, then would you need to be certified in that state?
Yeah, you do. You still do, which is, there's that tension. Like I understand that, but we're hoping for more reciprocity between states with that stuff, because telehealth, you're kind of still limited in some ways. Like, so I'm licensed in California and Colorado, so I can only work with clients that are residents of those places. They can live anywhere in those states, so it can be, but if someone reaches out from, New York or North Carolina or something, I can't work with them as a therapist. And that's another part of the reason what I was saying about the course I'm wanting to do. It's like I can offer an educational course, right? Something where it's pre-recorded. I don't have human to human interaction with them. I'm not their therapist, but I can offer them a lot of the tools and skills and education around that stuff. And that part, I don't have to be licensed in those states for that. But if I'm going to be their therapist, I have to have that licensure.
Got it. Well, thank you for sharing that. That's great advice. Okay. Yeah. Well, so you work with a lot of trauma affected adults, and I know it can be challenging, of course. So how do you personally navigate that emotional toll of the work? And what self-care practices do you find essential in maintaining your own mental well-being?
Yeah, no, that's a good question. It can definitely be heavy some days. And my wife is also a trauma therapist. So, we've heard some heavy stories and do a lot of days. So I think one thing that helps is really, I mean, physically, I would say, like, because obviously there's even a lot of sitting, or telehealth, there's a lot of sitting and looking at a screen. So for me, movement, exercise is really important. That you can kind of feel some of that stuff building up, like you're being stagnant and you're just absorbing or hearing these stories. And I think that's something that can happen. You can feel that kind of some days almost. And so to get moving, to get to the gym, to go swim, to we have dogs. We have too many dogs probably, so we'll take them for a walk. Just get out and get moving. I think that helps to just let stuff kind of run through you a little bit. Take care of your body. I think the other thing is I found mindfulness, and really just mindfulness being, even for me, just very simple, deep breathing. So effective and helpful for just refreshing, or to help me through a day, just even 10 minutes of it a day. I've been even recently getting back to more consistency with that. That's a really big deal for me in maintaining my own mental health. So even doing some of that in the morning, or doing some reading or some prayer in the morning is helpful for me to kind of prepare for the day and get myself ready, and kind of be in a space where I don't know, there's an interesting dynamic as a therapist, where you really want to connect with people and you want to feel what they feel and attune with them, but without taking it on as your own, and finding a way that you can, when the session's over, you can let that slide off of you and keep going with your own life. And so I find some of that morning time and that preparation, or getting myself in the right mental space, heart space, spiritual space, like, it helps me to be able to have more effective days, or carry less of that by the end of the day. So I think those are probably some of the main things for me. Been trying to also do like a little, just at night, like a little 3-item gratitude thing, where I just jot down what I'm thankful for the day. Just the last thing I am thinking about as I drift off is just positive or gratitude. And so I'd say those are some of the things that I've developed over the years, or found work for me. And it can be simple stuff. It doesn't have to be, extravagant or doing it for hours and hours. It can be just little simple stuff that makes a difference.
I love that. There's a lot in there for people to learn. And, I'm a huge fan of Brené Brown, by the way. And
Yeah.
She's from UT Austin, and all her books, and it's fantastic. And she talks about how there's a therapist for therapists as well, like, the ones who see just a therapist. So I guess that's not required for you. You don't see a therapist of your own.
Well, I'm glad you brought it up. I didn't even mention that part. Like I talked about earlier, with my burnout phase, I did therapy, and that's something I have continued over the years. Not straight through, but I'd say the majority of the time I'm trying to do some sort of therapy, or I might take a little break and then get back in it. And I'm actually starting back up with a new therapist soon too, just to kind of stay in a healthy space and keep working on myself. And so I'm glad you brought that up.
That is so fascinating though, because if anyone had any doubt if they need therapy or not, by, you, Ryan, telling that even you have a therapist to maximize your potential, people should know that everybody can benefit from therapy. And I say that all the time. This is fantastic.
Yeah. I'm obviously a big fan of therapy. So, and I want to, it's just good for people, I think, especially if you find a good therapist. But it's my one friend, he's also a therapist. He was doing therapy, and he said, I was asking him what he was going for, and he's like, well, it's just like I'm eating my vegetables. It's like same idea. It's just good for me.
Yeah, no, I like that. I like that analogy. Eating your vegetables. You got to do that.
Yeah.
Well, great. Fantastic, Ryan. Thank you so much. We've come to the end of our podcast, but this was such an enjoyable session. And, you and I have talked in the past as well. And I've told you that I'd love to stay in touch, and, would love to have you back on the podcast. I mean, we're here as entrepreneurs, as, the masters of our field, to help bring new solutions to life and make it much better for everyone. So thank you for the part you play. Thank you for all that you do. And thank you for your time for coming on this podcast.
Absolutely. Well, thank you. And it's been great to connect. And thank you for, being willing to put this out there, have these type of conversations, and appreciate it.
Thank you. Thank you so much. Have a good evening, Ryan.
Right.
Bye.
Take care. Bye.
Bye.